Welcome back. I hope you enjoyed your break. I am so excited to be joined by Dr. Ken Stein, who is the Chief Medical Officer at Boston Scientific. He is an electrophysiologist and a fellow AFib patient. I hear that there's some exciting news to share. Let's talk about Therapulse and the ablation news that you had first.
Sure, great, and thanks for having me. Uh, Let me just begin. What FARAPulse is. Very exciting, still relatively new technology for doing ablation for patients with atrial fibrillation. The news is based on a clinical trial that we recently reported out. We've now expanded the indication for that therapy so it can be used both to treat patients with paroxysmal AFib that comes and goes, as
Mm-hmm.
well as now patients with persistent atrial fibrillation. That is
Mm.
where you go into it and stay in it for a very long period of time. And the really exciting thing about FARAPulse and what really I think has transformed the whole field of ablation is that it's just very different from the prior technologies that we used to use. When I had my ablation back, oh gosh, now over 5 years ago,
Uh-huh.
we didn't have availability of what's called pulsed field ablation, which is what FARAPulse uses. And the big difference is the way we used to ablate people using either heat energy or cold energy had a risk of inadvertently injuring the tissues that surround
Mm.
the heart. And the great thing about FARAPulse is this pulsed field ablation can really
Mhm.
precisely target heart cells specifically without affecting the nearby areas. And so I think at this point there is no doubt but that the FARAPulse system is safer than prior ways of doing ablation, is at least as effective, and is a very highly predictable way to treat AFib today.
Right. Which should give patients a peace of mind as they are trying to make these decisions about what to do.
I hope so. And again, there's nothing more important as someone who's had the procedure myself, right, than knowing that it's going to be as safe as possible can be. And
Absolutely.
there are always risks when you have an invasive procedure. And I think, for anyone listening to this, very important to talk through those risks versus
Hmm.
benefits with your own physician. But going into it at least with the assurance that some of the more severe complications from prior ablation technologies can be avoided, I think really makes a big difference for patients and for physicians.
That's fantastic. Um, Now, I also know you have news around the Watchmen as well.
I do. It's a very exciting time as we look at therapy for AFib. And it's been transformed really beyond my expectation or recognition.
Mm.
And so the news, so the Watchman device is an implantable device that's aimed at helping reduce the risk of stroke
Hmm.
in patients with what's called non-valvular AFib. So AFib that's not caused by any serious problem with the valves in the heart itself. Uh, and Up until now, it's really been seen, as an alternative to the use of blood thinners for patients
Hmm.
who have reasons to avoid the use of long-term blood thinners, history of bleeding, risk of bleeding, things like that. And the new news is based on a trial that we did that was called the option trial. It is
Hmm.
now also indicated for patients who are still deemed to be at high risk of stroke, even after they've had an AF ablation. Uh,
Oh, interesting.
yeah, and it's like one of the important things I think for the folks who are listening to this understand is ablation itself, because it's not 100% effective, right?
Hmm.
Typically isn't considered adequate to avoid the need for some kind of therapy to reduce the risk of stroke, even
Right.
after you've had the ablation, even if the ablation seems to have been successful. And so for high risk patients, and physicians judge that risk by looking at something called the CHA2DS2-VASc score.
Right.
But for patients with a sufficiently high CHA2DS2-VASc score, you don't want to find out that the ablation didn't work when the patient has a stroke. I mean, that's obviously
Correct.
such a horrible potential thing to have happen. And so for the really high risk patients, right, we still do recommend that they get some type of preventive therapy. And what we showed
Right.
in the option trial was that in those patients, high risk patients, even after they've had an AF ablation, that the Watchman implant was as effective as blood thinners and was
Mm.
associated with much less bleeding than the blood thinners were.
Which for those of us who have been on blood thinners,
Yeah.
An active lifestyle on blood thinners can be
Yeah.
very dangerous.
Yeah, I had to take just for a few months around when I had my ablation. I'm an avid cyclist, skier, and
Mhm.
oh gosh, yeah, those few months were
Challenging?
not yeah, the challenging is a good word again, and not to disparage those drugs. Those are good drugs,
No,
and,
they're
and for
life-saving
patients
drugs.
with a reason to be on the drug, I would never want to discourage someone from taking it. But it's good now to have a potential alternative in Watchmen.
Absolutely, absolutely. That's fantastic. Two big pieces of news. I'm so glad that you were able to join us and share that news. If people are looking for more information, where should they go?
Yeah, I mean, first off, best sorts of information, right, is another medical professional.
Hmm.
Your doc, your caregiver, right? They can really sort of individualize and contextualize risks versus benefits. People who want to look up this stuff, as a company, Boston Scientific, we do have online resources. It's easy. It's www.watchman.com for Watchmen and www.farapulse.com for Farapulse.
Perfect. Ken, thank you so much for joining us, and thank you for supporting this wonderful Get Rhythm Stand Rhythm conference. We really do appreciate it.
Well, again, as a fellow patient, I thank you for having me and wish you a fantastic day.